Hey guys, welcome back to my channel. Today I am going to discuss about blood pressure. Blood pressure means the pressure exerted on the walls of the arteries. Arteries main function is what? Arteries main function is the blood will be carried from the heart to other parts of the body. Blood is carried from heart to various parts of the body. Arteries function is what? Blood will be carried from the heart to other parts of the body. Veins what will do? That will carry the blood from all the parts of the body to the heart. That is the main reason that I mentioned about the arteries. And arteries is when the pressure is exerted on the walls of the arteries. Suppose this is arteries, pulmonary artery. We have so many arteries will be there which will be supply the blood to all the parts of the body. So when the walls, if suppose this is the heart, this is the artery, the wall, this is the wall of the artery. Blood will be carried, right, like this. So when the pressure is exerted, certain pressure should be there in the wall of the artery. When this pressure is more will become or less will become, when this basically blood pressure means the pressure that is exerted beyond the normal, that is the blood pressure on the walls of the arteries, especially arteries wall. On the arteries wall the pressure is exerted, then it is called blood pressure. So I have mentioned you about what is the arteries and veins function, and then when the pressure is exerted on the walls of the arteries, then that is called as blood pressure. And now the main thing is that when, if suppose this is the ventricles, right ventricle and left ventricle, these are the ventricles. When these ventricles will contract, when ventricles will contract, contraction means what? Tightening, like it will be, it's not, it is opposite to relaxation. When ventricles will contract, like squeezing, like that is called, we will call it as systolic pressure. Systolic pressure, that should be around 120 mmHg. Okay, systolic pressure should be around 120 mmHg. When ventricles will contraction, when contraction of the ventricles will happen, what is the thing is that the blood will be pushed out to the other parts of the body through the arteries. That is, through the arteries the blood supply will happen to the other parts of the body. So when this ventricles contraction pressure should be around 120 mmHg, and that should be equivalent to, means that should be equal to the, or means there are two types of pressure. One is systolic pressure, another one is diastolic pressure. Two types of pressure is what? Diastolic pressure and systolic pressure. Systolic pressure should be 120, as I told you. Systolic pressure should be 120 mmHg and diastolic pressure should be around 80 mmHg. So systolic pressure means what? When the ventricles will contact, blood will be moved out other parts of the body. When there is a ventricles relaxation, when the ventricles will relax, what will happen? The blood flow from the auricles will reach again, enter into the ventricles. This is called diastolic pressure, that is relaxation phase. So systolic pressure means the pressure exerted when the ventricles will contract, that is 120 mmHg, and diastolic pressure is the when the ventricles will relax, the blood will enter into the heart through the pressure that is exerted due to ventricles relaxation. The blood will flow from auricles into ventricles. This total, so overall systolic pressure should be 120 mmHg and the diastolic pressure is 80 mmHg. 120 by 80 mmHg. This is the normal blood pressure should be for any individual. How we will measure blood pressure? Through sphygmomanometer. Sphygmomanometer is the device that is measured for the blood pressure. So blood pressure should be maintained compulsory at the level of 120 by 80 mmHg. If there is more blood pressure is also not good, and less also it will be harmful for a person. So ultimately you should be maintaining a particular pressure, that is 120 by 80 mmHg, and the device that measures the blood pressure is sphygmomanometer. And what is the pressure will be systolic. 120 means systolic pressure, 80 means diastolic pressure. 120 systolic pressure because when the ventricles contraction happen, the pressure will create in the walls of the artery to push the blood to the other parts of the body. And when the diastolic pressure will happen, what will happen? The ventricles will relax, then again the blood will return through the auricles and enter into the ventricles. So this overall the pressure is called the blood pressure. If you like my video, for more updates please like, share and subscribe to my channel. Thanks for watching guys.